You're listening to the Assembly on Sleep and Respiratory Neurobiology podcast, brought to you by the American Thoracic Society.
Hi, welcome to the SRN Pioneers in Sleep Medicine podcast. I'm Refika Ersu, and I'm in the company of Dr. Perez, and we're both from the Sleep, Respiratory, and Neurobiology website committee.
Today, we are delighted to speak with Dr. Sally Louise Davidson Ward. Dr. Ward is the Chief of the Division of Pediatric Pulmonology and Sleep Medicine at Children's Hospital Los Angeles. She published seminal papers in pediatric pulmonology and sleep medicine, which have moved our practice forward. This includes the normal polysomnographic values for children and adolescents that we use today. She has guided and inspired a long line of mentees to pursue a career in sleep medicine. In recognition of her contributions, mentorship, and leadership, she is the recipient of the 2022 American Thoracic Society Pediatric Assembly's Lifetime Achievement Award. Welcome, Dr. Sally Ward.
Thank you, Iris. Thank you, Refika. It's an honor to be here.
Tell us a little about your background and education.
So I grew up in San Diego. Both my parents were physicians. My mom was a pediatrician and my dad was an internist. And my dad thought I should have a lot of early work experience. So from junior high through high school and college, I worked in his office every summer. So I had an early experience to the back office activities of a private internal medicine practice. And I was very involved in equestrian activities and camping with my parents and spending time in the outdoors. So I went to college at UC Davis with a plan to become an ecologist and save the world like John Muir and Jane Goodall. And it was a great undergraduate education, and I majored in zoology because there was no environmental science or ecology major at the time, and that was as close as I could get. And then finally working through all my undergraduate requirements, I finally got to take my first ecology course the very end of my junior year in college, and I didn't like it, not one little bit. And I had really enjoyed working in my dad's office and working with his patients and hearing their stories. And at the same time, I was taking a human physiology class, which I just absolutely loved. I went to all the lectures, all the discussion sections. And so I really had a big think about what I was going to do. And I thought, well, I love physiology and I love my dad's patients. And even though it feels like I'm kind of a cookie cutter with my parents, I decided to apply to medical school. This was back a long time. I'm a pioneer, right? So it means I'm really old. And this was a long time ago, and there were not that many women in medicine. And so I went to my advisor, and they advised nursing school, which I have great regard for nursing, but that wasn't the direction I wanted to go. So I figured it out on my own. I took all the requirements I needed, and I was eventually accepted to UC Irvine Medical School, where I spent 4 years. And then I did my residency in pediatrics at the LA County General, which was called LA County USC. And the two best pediatricians there were pediatric pulmonologists. And I had taken an elective at Children's Hospital in Pulmonary when I was a medical student. So I had an idea that maybe I could spend some extra time after my residency, do a clinical fellowship before venturing off into private practice. But a couple months into it, I fell in love with pulmonology, and I did 2 years of clinical pulmonary at County. And then I came over to be Dr. Keen's research fellow for 2 years. And that was here at Children's Hospital Los Angeles, where I have been ever since.
Thank you. How did you get interested or involved in sleep medicine, Dr. Ward?
Well, when I came over here as a research fellow with absolutely no experience in research, Dr. Keen's was working in the one of the things he was interested in was apnea of infancy and exploring the apnea hypothesis of sudden infant death syndrome, which has since been discounted. But as his research fellow, I really did what he was doing, and it was related to sleep. And we started to think about apnea and realizing all babies have apnea. So maybe it wasn't the apnea per se that we should be interested in, but the rescue responses, the physiologic ways that babies can restore their breathing. So became very interested in arousal from sleep, and sleep medicine became one of the focus of my career.
And who mentored you and helped and inspired you? You mentioned Dr. Keynes a little bit, but
yeah. So Dr. Keynes, it's been my mentor my entire career. In many ways, I was fortunate to do lots of research projects with him over the years, and he mentored me in other ways. And one of the early inspirations I had was as a fellow, or maybe I was a junior attending. I went to one of the very, very early sleep meetings. Which eventually evolved into the American Academy of Sleep Medicine, and it was in San Diego, and it was a very small meeting compared to what the medical meetings are now for big societies. And I was literally like a kid in a candy store. I just thought everything was so fascinating. I thought, gosh, this is like uncharted territory, because no one really, we didn't learn anything about sleep medicine, certainly as a resident, and not much as a medical student. And it was just enchanting to me. So the research we were doing and that first exposure to sleep medicine really inspired me. And then, over the years, the success of the folks who've trained here with us at Children's Hospital, especially those who've gone on to pursue careers in sleep medicine, has been a sustaining inspiration. And then every week, my patients inspire me. The successes we have, the things that families do for their kids, the way that kids can really adapt to acute and chronic illnesses, is just a constant inspiration.
Of which achievement are you most proud of?
Well, I think I mentioned it earlier, but the success of the fellows who've trained with us. And one of the things that really excited me was when the ACGME and the American Board of Specialties recognized that sleep medicine as a distinct subspecialty. All the different pulmonary fellows who went on and grandparented into that first sleep medicine board given by the American Board of Specialties, like realizing that even though they were pulmonary fellows, that they really caught the sleep bug was really exciting for me. So that's an achievement I'm really quite proud of. And then seeing their successes throughout their careers has been just a real delight. And then, other things that we've done here, creating the sleep center, getting our sleep lab accredited by the ASM, developing our sleep medicine fellowship, are all things I take great pride in, and kind of look at those as part of a legacy.
What brings you the most joy professionally?
I really like working. So, there's lots of things that bring me joy. The fact that as a division head, I've been able to help mold this division, hire faculty, support their careers. That gives me great joy. Thinking of new research ideas and then seeing them be carried forth and published is super fun. That's just like frosting on the cake. And then, as I mentioned, working with patients, it's just very joyful to see them on my list. Like I have clinic tomorrow, so I'm looking at who I'm seeing tomorrow, and looking forward to seeing the parents because I have like I'm a pioneer, right? So I'm old, so I've been taking care of some of these kids for 10, 15, even 20 years, and that is a joyous to me, something that's a real privilege to be a part of their lives. And then the successes that we have. One of the very first patients that I started on PAP therapy is a child with with golden horse syndrome who had really significant sleep apnea. And he was a very motivated student, and he was falling asleep doing his homework. It was just a real struggle for him. And he took to PAP therapy like a what is it, a fish to water. And after being on the therapy for a month or so, he had tears of gratitude. It's like, I can stay awake for my homework. I'm really doing great. That, those kinds of successes are, they're just unparalleled. You just can't beat that feeling.
So inspiring, Dr. Ward. What brings you the most joy personally?
Well, my daughters. First of all, I have 2 great kids who are doing great things, and we're very close. So that's a huge source of joy. And then, colleagues like yourselves, getting to maintain relationships over many years is very, very joyful. I mentioned as a kid, I was an equestrian. Well, I still am, still riding every week pretty much. And that's my form of self-care, meditation. And I very much enjoy stepping out of the role of being a physician and spending time in a totally different environment where I'm just, one of the gals. And that's a source of great joy. And my husband, we've been married for 45 years. He's just very supportive. We're a good team. We enjoy each other. And that's certainly a source of joy as well.
How did you keep up your career momentum? That has been so impressive, Dr. Ward.
Well, first of all, I love medicine, and I love science. So I still get a paper copy of the New England Journal of Medicine. So when a aforementioned husband is watching basketball, I can sit there in the living room and read my New England journals. And I'm always challenged by the clinical pathology case, especially if it's a pediatric case. I want to see if I can figure out what the diagnosis is just by reading the title. So I enjoy that. I enjoy medicine. I enjoy science, and that it keeps my intellect engaged. And I've been fortunate. I ended up through a series of unplanned things, getting to do something that I've really enjoyed. And I've been blessed with good health and a healthy family. So those things have allowed me, to continue to focus on work. And, I just really have been also fortunate to work at Children's Hospital Los Angeles, where we are serving a large population of children with significant healthcare needs who may be otherwise underserved and have healthcare disparities and barriers. And we work together as an institution to overcome those. And it's the physicians, the nurses, the therapists, the administrative team. Everyone is really focused on that mission of caring for these children. And it's just a very sustaining place to work. And then, getting back to the patients themselves. So it's not been a struggle. I've been very fortunate in many domains to have been able to keep doing what I like doing.
Is there anything you would have done differently?
Well, when I think back about that ecology course that I didn't end up liking, even though I still love the environment, it was really the statistics that really were boggling my mind and I didn't like. And then when I became Dr. Keene's research fellow, there was a possibility I could have taken a statistics course, and we couldn't figure out how to make that happen. And if I would go back in time and speak to young Sally, I would say, no, whatever you do, take that statistics course, because I would have really loved to have that background and that knowledge. So that would be one little thing I would have done differently. I think that was an opportunity that I lost. And then, I think a lot of women in medicine who started in my era were a bit intimidated, and that can lead you to thinking that maybe you don't 100% belong, and then you withhold your thoughts and your ideas. I would have liked to to go back in time and say, hey, some of those ideas were really good. So speak out. Don't be afraid of being wrong, because sometimes you might be right. And I would definitely do that differently. And I would advise anybody in medicine, no matter who they are, to speak out, share your ideas, and be brave in that regard.
If you have not been involved in sleep medicine, what do you think you would have done instead?
Gosh, well, I have an alternate career in mind. I would open a flower shop. I would call it the Happy Occasions Flower Shop, and it would be only happy occasions. So, there's a lot of what we do that can be and it can be hard emotionally, and so that's my alternate career would be that. But if I hadn't been a physician in sleep medicine, I think I might have ended up in psychiatry. I really like talking to people, helping them with difficult problems over time. I definitely not have the right mindset or personality to be an intensivist. I'm very comfortable with, chronic care and getting things done over time. Slow progress is just fine with me as long as we're moving towards a goal. And I like that aspect of sleep medicine, counseling people about sleep hygiene and parents about behavioral insomnia of childhood. And I enjoy that kind of talk therapy aspect of sleep medicine. So psychiatry was a close second to pediatrics when I was picking out my residency.
Wow. What are the biggest technological innovations or changes you have seen over your career, Dr. Ward?
So when I began in sleep medicine, we were still using paper strip chart recorders and scoring events by hand. And that has changed, of course, dramatically. Now we have computer acquisition systems and storage systems. I mean, we filled up a whole warehouse of paper sleep records, back in the day. Now it's servers. So certainly that's a huge change. And then positive airway pressure was just coming into play when I started in sleep medicine. And that, of course, has revolutionized the care of individuals with obstructive sleep apnea. I certainly didn't anticipate, though, that we would have so many children impacted by elevated body mass index and obesity, and how that would change our field so much, and how it would have been, and how it was accelerated during the pandemic, such that we're seeing children now with ultra severe sleep apnea that I never thought I would see, much less become common. So I think those are pretty significant changes. I guess obesity epidemic isn't an innovation, but and then the idea that there are medications on the horizon that will impact sleep apnea, that's certainly a very welcome innovation. And I think what we see ahead is going to be even more amazing. I tell learners, if they're feeling discouraged, that today is the best day to be a physician, and the only day better is tomorrow, because these innovations that happen are not going to stop. They're going to continue. The humans are endlessly curious, and science will continue.
Thank you. Maybe you mentioned this a little bit about the obesity, but are there anything else that was surprising to you over the course of your career?
Yeah, early on in sleep medicine, I really didn't realize that I would see children with narcolepsy. So that was surprising, especially after the H1N1 flu epidemic a while back, that we saw a flurry of kids with narcolepsy, and how serious a condition it is, and how life-changing it is. So that's definitely an area that I was surprised, and certainly hopeful that the future will bring better diagnostic therapies and better treatments for those children. I think the explosion of sleep medicine as a career has also been surprising, but also welcome. I mean, it's a third of our life, right? And it's sleep disorders impact so many domains of health. But to see, that we had, I don't know, Dr. Perez, how many fellows applied to just our little program here at Children's and Keck for fellowship? We had so many applicants. So the explosion of the field has really been a delightful surprise to me.
What do you think are the biggest challenges for the field of sleep medicine?
Well, I think artificial intelligence is something that's on the horizon, and will be not a bad challenge, an interesting challenge to see how it becomes integrated into what we do, and how that will change our day-to-day lives. So we spend a lot of time looking at squiggly lines on a computer screen as human beings in sleep medicine, interpreting sleep scoring and interpreting sleep studies. And perhaps that's something that could be enhanced or even replaced by machine learning. And then how that will free us up to do more direct patient care, I think, and to have big data that can be analyzed in different ways. So that'll be an exciting challenge. I think challenges that will be more difficult. One of the things that I love about sleep medicine is it's so multidisciplinary in nature, and it really is suited to multidisciplinary clinics. And I think that's that requires us to advocate with our hospital administrations and clinic administrations, because that there may be some financial disincentives for that to happen on the hospital side, whereas on the patient and provider side, it's really so nice to be able to interact with your colleagues in a real-time basis and provide patients with multidisciplinary answers to their concerns, and to limit their visits to one rather than 4 or 5 or even more separate visits, so we steal less time from them. An example that I look towards is the craniofacial team that I've been a part of for a long time, and how I insinuated myself into the team as a pediatrician, and then sneakily introduced sleep medicine as an important field for children with craniofacial differences. And I would love to initiate a multidisciplinary Down syndrome clinic, because that's another group that has multidisciplinary needs, including sleep apnea. So that's I think is a challenge we need to really continue to work towards advocating for, getting us together with our patients in the same environment for their benefit, even if it might not be 100% the best decision financially for institutions. There are some acute challenges right now in the United States related to science and research and protecting vulnerable populations. So that is an immediate challenge that I think we don't yet know how to respond to, but we are I'm a pediatrician. I advocate for children, and we will have to continue to do that.
So what advice would you give people who are new to the field, Dr. Ward?
Well, I think I mentioned one of them, which is the multidisciplinary nature of our specialty. And you can see that in how the individuals who can take sleep medicine fellowships and sit for the sleep medicine boards hail from so many different backgrounds: pediatrics, internal medicine, adult and pediatric pulmonology, otolaryngology, psychiatry, neurology. And I think I'm probably leaving out a couple more. Like maybe I think anesthesia is on the list too. So the nature of what we do is multidisciplinary. And so to really embrace that and to engage in that as much as possible, so that we can learn from one another and enhance the care of our patients. We've been super fortunate to have within our own division here pulmonologists, pediatricians, and neurologists, and I have to say it's just been a real multiplier of what we can do for our patients and how we can learn from one another. So I would say to really embrace that, and to keep understanding the impact of sleep disorders in so many different health domains, and advocating for including sleep as an outcome in research studies, because you really can miss the boat if you don't. And so I think those are two areas that I would encourage people to focus on.
Thank you so much, Dr. Ward, for these valuable insights and sharing your wisdom with us, and for all the people that you have graduated from CHLA. I think both myself and Iris are very, very proud and thankful for all you have done for the fellows and for the field. And also, on the behalf of the American Thoracic Society SRN Webinar Committee, would like to thank you, and looking forward to meeting you in the future. Thank you.
Well, it's been a pleasure. Thank you for including me as a pioneer, and great to see you both. You are definitely part of the joy. Both of you have contributed measurably to my personal and professional joy.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more podcasts from the ATS assemblies on YouTube. Don't forget to like, comment, and subscribe so you never miss a show.